Now we are on to the pitches from our 7 pre-seed companies. So every company in this section of our showcase is actively looking for angel investors. Several are almost at the seed stage. Please reach out to the founders if you can help. To cheer on our last panels of startups, I really am proud to introduce you to Nathan Sundheimer from Plug and Play. Thank you, Nathan, so much for being here.
Thank you so much for the introduction, Susan. And I have to say, it is such a pleasure to be here today with a community of individuals who are striving to drive women's health tech forward together. As Susan said, hi everyone. My name is Nathan Sundheimer and I lead US Healthcare Partnerships and co-lead our Digital Health Accelerator at Plug and Play. Here at Plug and Play, we have a program called Found Her, which is an initiative created by individuals who want to better support our female founders in women's health tech by building a global network of investors, mentors, and entrepreneurs. We aim to increase opportunities for women in the startup world by providing resources and building connections, really leveling the playing field for women within the innovation and entrepreneurial spheres. So as we reflect on the panel discussions that were extremely insightful and digest the cutting edge innovations that we've seen from our previous presenters, we're now going to transition toward the 7 pre-seed startup pitches today. Similar to the previous sections, I'd like to state that the startups will present in alphabetical order and be going back to back, so we will not be introducing them individually. Each startup will have 2 minutes to pitch. And as Susan previously mentioned, obviously it is impossible to fully encapsulate the efforts and successes of a company in 2 minutes, but let me tell you, you are going to love each of these companies. Each of these startups are looking for an investment, mentorship, and partnership opportunities. So keep your ears peeled so we can find ways to help them out together. So let's get this ball rolling. To get us started, I'm going to hand us off to Jessica from Frame Fertility. Jessica, the floor is all yours.
Fantastic. Thank you. I'm Jessica Bell Vanderwall, CEO and co-founder of Frame Fertility. We enable the early detection of fertility risk and care navigation to help people meet their fertility goals and improve their overall health. Next. Today, if I want to have kids later in life, my options are basically get lucky and get pregnant when I want to, or use treatment proactively or reactively. We at Frame believe there's another option that doesn't involve yet more procedures to ideally avoid procedures in the future, such as IVF. Next. We built Frame based on our 10-year fertility journey combined with working directly with patients and clinicians in this space. So here is how our experience could have been different with Frame. Before my upcoming Well Woman exam in my late 20s, well before I started trying to conceive, I would have filled out a holistic questionnaire that identified undiagnosed PCOS, a thyroid disorder, and some lifestyle considerations for me and my partner. The results, including an easy to understand fertility score generated by Frame's clinical algorithm, would have been reviewed with me in a coaching call with Frame before my appointment. My doctor would have also been armed with this information as well as my fertility goals to ensure that our visit was productive and efficient. Frame would then continue to support me in my next steps, from reminding me to remove my IUD or when it's even relevant to think about my caffeine intake. The result, we likely wouldn't have needed treatment to conceive my daughter Parker, and I might not still be dealing with my underlying health issues. Next. And we aren't alone. Fertility treatment drives a $10 billion market in the US, and that is before considering other costs related to fertility complications and a lack of preventive care. Next. We have launched our MVP to paying customers with great feedback and are now working with providers and payers to pilot and insert Frame into the clinical workflow and build the proof points needed to scale and go to market. Next. We are a family supporting families. Our combined 30 years of experience in digital health is complemented by our amazing clinical team and advisors, as well as other founders and subject matter experts critical to the business elements of our company. Next. We are about to kick off our pre-seed fundraise and would welcome conversations with interested angels and other investors. Thank you very much for your time.
Hello, everyone. My name is Ashlee Wisdom, and I'm the co-founder and CEO of Health Inner Hue. Health Inner Hue is a digital health platform for women of color looking for culturally sensitive and personalized care. And I'm going to tell you why women of color, and particularly Black women, are so excited about what we're building. Next slide. Because racial bias in healthcare is well documented, many patients of color prefer to connect with providers who they can trust to see their humanity, listen to them, and take their concerns seriously. And oftentimes, this means finding a culturally aligned provider. But making connections to these providers is difficult because healthcare providers of color are underrepresented in the industry. And it's really difficult to find them online and even harder to find them in their insurance network. Next slide. Black women are unfortunately bearing the brunt of this problem, and it results in nearly 1 in 8 avoiding the care they need because they fear being dismissed, disrespected, and not taken seriously. Next slide. This is why we're building Health Inner Hue, and we're starting with a focus on Black women. Through our platform, members can easily search for and connect with culturally aligned and sensitive providers. They'll have access to a content library with evidence-based health content that is also culturally attuned, and a dynamic community for both care and clinical support. Our members will also have the ability to consult Health Inner Hue providers asynchronously. We plan to offer training modules to providers on Health Inner Hue so that over time, we can have providers of all backgrounds who are committed to providing equitable and competent care to women of color. Next slide. We've had success building strong brand recognition. Our dynamic community is our secret sauce. When we released our first MVP last June, we had 34,000 unique logins in the first 2 weeks, and now have over 800 providers and practitioners who've signed up to be a part of our growing network. We launched our new MVP last week on iOS and Android and have already seen over 3,000 downloads. Next slide. My professional and academic background is in public health. I have an MPH from NYU and have worked in a variety of healthcare settings. My co-founder, Edwina, is a second-time founder with an MBA from Columbia University, and we have amazing advisors. Dr. Nzinga Harrison is the CMO of venture-backed Eleanor Health, and Dr. Ivor Horn is the Director of Health Equity at Google and was formerly the CMO of Accolade Health. Next slide. We are getting ready to close our $1 million pre-seed round. If you're an interested investor, you can email me directly. And we're also looking for health plan and employer partners as we revolutionize healthcare for women of color. Thank you for the opportunity to present and for your attention.
Hi, my name is Caitlyn Hoeflin, and I'm part of Hera. And today I want to talk to you about how we protect and improve the life and quality of life for refugee women. So we know from the research that women and children who are forcibly displaced from their homes are up to 60 times more likely to die an untimely death. And we also know that a lot of this can be prevented with proper medical care. There are a lot of barriers that stop refugees from getting care, and these can include things like competing demands, such as trying to find a place to work, a place to go to school, a place to live. And these can include fear as well, fear of interacting with authorities. Many refugees have missing records, and are unfamiliar with whatever healthcare system they're interacting with. And in addition to all of this, there's very often a language barrier. Next, please. Next, please. So because of these barriers, we've created the Hera app. And what we do is we help connect people with the healthcare that they need. From our work in Turkey, we found that about 80% of refugees have access to mobile phones. So jumping off of that, what we do is we help women schedule health appointments via their mobile phones. We send them reminder messages about when their appointments are coming up, and we know from research that this is a fantastic way to help pregnant women attend checkups. We also provide important information for women about their pregnancy. Women and our users are able to access reliable information about pregnancy nutrition, childcare, and general health nutrition as well. Hera also is a safe place for our users to store their encrypted healthcare data. So this way, even if someone needs to leave quickly from whatever situation they're in, they're still going to have access to their medical records. Next slide, please. We designed Hera to be modular so that we could add features as the community needed them. And our first real-time demonstration of this has been with the COVID-19 pandemic. And during the past year, we managed to track symptoms among our users. Next slide, please. We believe that Hera can and should be used in both ongoing crises and also in new crises, where large-scale refugee organizations are implementing Hera to collect data and also share information with users, often in very difficult conditions. Next slide, please. And today what we're doing is we are seeking like-minded funders and potential medical partners who are interested in improving the lives of refugee women. Thank you for this opportunity to talk to you. It's been an honor to present today. Next slide, please. Oh, next slide. All done.
Hello, everyone. My name is Sheena Franklin, and I'm the founder and CEO of Ruth Health, a woman-focused virtual dermatology clinic. And we are reimagining dermatology with a culturally competent whole person care approach. Next slide, please. We provide personalized care to over 70 million women of all skin tones who are experiencing various skin traumas and conditions as they battle anxiety, finding the right practitioners, and frustration over the wrong diagnosis and treatment. As less than 40% of dermatologists practice integrative medicine, and where roughly 50 of dermatologists are ill-equipped to treat skin of color, with women of color having an added layer of anxiety and frustration. Next slide, please. Through our inclusive AI and wraparound telemedicine mobile app, we provide care from highly sourced and vetted practitioners skilled in integrative dermatology and skin of color directly on our platform via virtual visits, private messaging, and at-home skin health monitoring. Next slide, please. In this $21 billion market, women experience at least one skin condition every year due to internal health and/or environmental factors. And we provide an affordable monthly membership plan without the need of complicated medical insurance. Next slide, please. We have seen early support from champions such as Startup Health, and we have completed our research pilot with just over 2,000 women and with a leading school of dermatology. We also have seen early interest and started conversations with key leading industry partners. Next slide, please. As I round out my presentation, I look forward to continuing the conversation to share more about who we are and what we're building here as Keps Health, as we're looking for like-minded angel investors and partners. Thank you.
Good afternoon, I'm Soody Tronson, I'm founder of Presque. After witnessing my niece struggle with breastfeeding, similar to what I had experienced years earlier. Next. So she thought she didn't have enough milk and that her son could not latch properly. So she turned to formula bottle feeding. And when she turned to bottle feeding, it reduced her milk supply. This happens a lot among moms who want to breastfeed for at least 3 months. 60% win early for the same reasons. So here comes Presque, a family of smart nursing bros. Presque lets my niece measure how much breast milk she's giving her son. If she does have to supplement, she doesn't have to sacrifice her latch because Presque is connected to her breast. Presque is simple to use and formed from soft silicone with customizable skin covers and hidden technology that makes it almost like nature. Presque is covered by insurance and affordable for the many who don't have healthcare coverage. Next. Next. The hardware includes breast milk and latch sensors, regulated supplement delivery, and a design that allows for supplementing while breastfeeding, with software and app features that include mother's knowledge, telehealth, electronic health records integration, and chatbot counseling. Next. Presque will be offered to parents directly and through hospitals and clinics, providing a diverse revenue stream. Next. We have a dedicated team of bi-continent experts with diversity in background, culture, and experience in product development, commercialization, and lactation, including in communities of color most impacted by insufficient breastfeeding. Next. We have demonstrated buy-in, technical feasibility, received 6 patents, and recognition in US and Europe. With 140 million births each year, there's plenty of opportunity for impact. We ask for your help with introductions to investors, granting bodies, and manufacturers. Thank you.
Hi there, I'm Alison Greenberg, co-founder and CEO of Ruth Health. I'm joined right over here by my co-founder, Audrey Wu. And we are an AI-powered platform for cohesive at-home pregnancy care. But for our patients, we're a home and digital healthcare clinic for pregnant people. Next slide. So the problem in maternal healthcare in this country is so big that it was hard to bring it down to just 3 things. But if we had to do that, the problem is these 3. It's fragmented. Care is inaccessible due to cost. Prenatal and postpartum are treated like 2 completely different times in a woman's life, and they are connected. The second problem is actually the biggest problem. There's a lack of diverse data in maternal health care, and that lack of data is hurting patient outcomes. But at Ruth Health, it's an opportunity to build the largest and most diverse data set in maternal health care in this country. The only cross-sectional large data sets that we have to date are really coming from Medicaid and the CDC Fast Facts. These are great data sets and we use them to build Ruth Health. But importantly, they are either broad but not deep or deep but not broad. And finally, the pregnancy tax. Every single birthing person pays the pregnancy tax in time and in money. And that's why we built Ruth Health. Next slide. So with Ruth Health, we are an accessible, centralized AI-powered platform. In 2 minutes, if you're pregnant, you can book an ultrasound house call, a telehealth pregnancy coaching appointment, and once we launch postpartum, so much more. And you can have that appointment in the comfort of your own home 7 days a week, 8 a.m. to 8 p.m. to meet the demands of busy working mothers and birthing people of all kinds. What we can do with that patient care is actually much bigger than the patient experience. It's building an unprecedented database on pregnancy. With our AI-powered chatbot and biometric readings at every step of the way along prenatal and postpartum care, we will build the largest, most diverse longitudinal database on maternal health care in the US. And we'll use it to improve health outcomes. But most importantly, we'll protect it with our lives and with the blockchain. How we'll do it is by accepting diverse payment methods. So we'll accept insurance, top insurance in a given geography, HSA and FSA, Medicaid. We're super excited about accepting Medicaid and good old cash. And finally, all the care we provide is at home, convenient, and designed with human-centered approaches. That means we meet patients where they are and where maternal health care started at the beginning of womankind, in the home. The Ruth Care methodology that we developed with our chief medical officer is including better bedside manner, continuity of care, critical methodology developed 10 years ago with midwives, and centering pregnancy, a clinically proven methodology as well that improves health outcomes by reducing the risk of C-section, preeclampsia, and preterm birth. Next slide. So what's our timeline? We're moving extremely fast. This company was developed in the pandemic alone, but we started actually with a medical device, and that was the catalyst for Ruth Health. Now, as Ruth Health, we will own the mother-child ecosystem of at-home care. We launch our prenatal pilot now, just a little bit later at Q4 of 2021. We'll be launching abdominal ultrasound house calls and pregnancy coaching via telehealth, but we actually already launched. Then we'll go to postpartum and pediatrics. Next slide. So finally, I'd like to thank you on behalf of the entire Ruth Health team, myself, my co-founder, Audrey Wu. We have a combined 11 years experience in conversational AI, and our chief medical officer, Dr. Vivian Greenberg, who's a 40-year OBGYN responsible for the delivery of 30,000 babies. That is not an exaggeration. And importantly, she's not just an OBGYN, she's my mother. So we're very excited to build for mothers and to be powered by a mother. Also important is we just got into Y Combinator. So as you can see, we're working hard, excited to be members of the summer 2021 batch. This is my co-founder, Audrey Wu. We're so proud to be presenting here with Hit Lab among these incredible founders. Thank you so much for your time. And my ask is actually that we'll be raising a seed round or Series A round in about a year. Please reach out. We just closed an oversubscribed pre-seed round, but it was about a week ago. And finally, seeking partnerships with New York City physicians, hospitals, and healthcare systems, especially home health agencies. Thank you.
Hello, I'm Andrea Ippolito, and I'm the CEO and founder of Simplyfed. At Simplyfed, we are rethinking the infant nutrition category. Next slide. 3 years ago, when I had my daughter May, she was born early and underweight, and I had trouble producing breast milk, so she continued to lose weight. I had trouble getting access to support from experts where and when I needed it. Next slide. By improving access to breastfeeding support, we can improve health outcomes for babies and help improve health of moms, including reducing the risk of breast and ovarian cancer. Also, increasing breastfeeding rates has a strong return on investment for health plans. For every dollar spent on breastfeeding support, they get $3 back in cost avoidance. Based on my experience as a parent and deploying telehealth systems with the military and the Department of Veterans Affairs, I founded Simplyfed to tackle this problem head on. Next slide. Simplyfed helps new parents get access to breastfeeding support from the comfort and safety of their own homes via telehealth from board-certified lactation consultants or IBCLCs. We first start by building a relationship with moms during pregnancy by providing information surrounding infant feeding options. Then we surge support if they have any questions or when they're struggling with their breastfeeding and infant feeding journey after their baby's born. We help increase breastfeeding rates for those that can and want to. Then we're there to support them during their transition of formula. where parents ally in their journey and allow them to feel good about their choice. Next slide. Over the next 2 years, we're also working with commercial health plans, Medicaid plans, and employers to help increase breastfeeding rates for their populations. We're excited to announce our partnership with Milk Stork, which is a leading brand in the breastfeeding space, along with our other partnerships with Sesame, Ruth Health, and Unite Us to help us grow our brand and reach. Next slide. We have an incredible team to support this mission. I'm an exit-tested entrepreneur who previously sold my last company to Athena Health, and I have extensive experience working in highly regulated industries, including helping the chairman and the Joint Chiefs of Staff deploy their telehealth systems surrounding behavioral health. Next slide. My ask is that we're looking for partners at Medicaid plans, OB-GYNs, and pediatric practices to collaborate with us. We are Simplyfed, and we're reinventing infant nutrition by building products that parents can feel good about for their most precious cargo. Thank you.
Thank you, Andrea. What a great way to close it out. Thank you so much, this amazing group. It's wonderful to hear what each of you is building. At Hit Lab, we have many ways that we engage the women's health tech community. We have a signature event, the Women's Health Tech Challenge in October, where 7 companies will compete for prizes. And every year, about 125 companies apply to the challenge from over 20 countries. So half of today's companies have been a part of the Hit Lab challenges in the past. So we encourage all startups in the women's health tech community to apply.